Hi, everyone. My name is Amanda Gamboa. I am the Director of Communications at the Foundation, and I'm mom to Ripley, who is full of joy and song and who has Kabuki syndrome type 2. I want to give a big thank you to our guest speakers and our teammates today for sharing updates and their ongoing work behind the scenes as well. For the next two talks, we're going to focus on how we're preparing for clinical trials as a community. As we mentioned, LEAP is the roadmap to treatments for Kabuki syndrome, and clinical trials are a very necessary step. A lot of planning, research, and community participation has to happen before a trial even launches. We have initiatives that support clinical trials at each stage of planning and at implementation. These include Kabuki Count, updating the prevalence of Kabuki syndrome, our data repositories, and the steps we're taking to improve the diagnostic odyssey, which is the often lengthy journey many people have to take to find their diagnosis. This list here is a snapshot of some of the research opportunities that KSF has either created or collaborated on, all of which contribute to making us clinical trial ready. Some have over 1,000 participants and are growing, while others require fewer than 30 families. This year, we're celebrating recruiting 464 participants so far, not including our contact registry and Kabuki count, and not including those dozens of you who have already completed the survey today. But if we even add that to the total participants in Kabuki count, we are at over 1,600 participants for research, and we thank each and every one of you. We do work hard to also reduce the barriers to participating to make it as easy as possible, because we know that you live with additional demands on your time every day. But we also know that we are the only ones who can participate in this research that enables treatments. Your data and your time make clinical trials possible. To that end, we've curated a checklist of the current studies that are open. In just 30 minutes, you can actually complete 4 of the 5 opportunities on this checklist. I want to quickly highlight Gestalt Matcher, where you've been asked to upload 5 photos that help other people diagnose faster. Dozens of families have completed the consent for this study, but we're asking you to now return and go ahead and complete the upload process with your photos. Otherwise, the time you took to do the consent is time lost. Gestalt Matcher is so important. It is one way that we can find more people with Kabuki syndrome, and I want to touch on why that helps everyone. Helping more people be diagnosed faster not only helps them access better healthcare and community, but it also creates more momentum for all of us for treatments. In the rare disease world, the more people we can find that can contribute data and can participate in a clinical trial, the better. And we are leveraging the latest technology at KSF to make that happen. Gestalt Matcher uses AI to look at the unique facial features of Kabuki syndrome. The fingerprint study uses a tiny digital scanner to look at unique fingerprint patterns, and genetic testing is faster and cheaper than ever. On our website, we have half a dozen options and education for genetic testing right now. And these advancements are very exciting, but there is still work to be done, like making sure Kabuki syndrome is recorded, same way in every medical chart. That's the ICD-10 that I'll talk more about shortly. Kabuki Count, the awareness campaigns that we do online and in person, outreach to clinicians and researchers around the world, and even Google Ads. We are helping more people be diagnosed faster and getting them connected to research and resources in a multitude of ways that we continue to expand. This is how we successfully prepare for clinical trials and how we make them happen faster. I'm thrilled to share that in just 1 year, we have connected with over 1,200 individuals with Kabuki syndrome from around the world. Kabuki Count is our global census and contact registry that launched last October. It contains key information for clinical trial planning and outreach, like age and type of Kabuki syndrome. Everyone registered can be contacted for research studies and trials that they may be eligible for. Many clinical trials end often prematurely because not enough people know that they even exist. Kabuki Count helps ensure that that won't happen to our community. And this image is just a snapshot of some of the countries, but you can view all the countries on kabukicount.com. And it's been amazing to use aggregate data like this when research labs, pharmaceutical companies, and our rare disease cousins reach out to potentially partner with us. Many of them are quite frankly impressed that our community is so active and organized. As you all continue to participate and share Kabuki Count, we will continue to grow. And that growth helps show that we're finding more people. We are creating more momentum. Please visit kabukicount.com to be counted in less than 3 minutes if you haven't yet. It's available in English, French, and Spanish. If you have, share it on your social media and check out the 10 advocacy organizations listed here that we partnered with to make it possible. Now that we've covered the research studies that you can participate in, today I want to talk about how we're updating Kabuki syndrome prevalence more behind the scenes as well. So you may have heard that 1 in 32,000 people have Kabuki syndrome. This stat is actually from 1988, before the World Wide Web was launched, before we had genetic testing. Honestly, it's even older than me, but it is the only based on the number of births that were observed in Japan at that time. Prevalence is scientifically defined as the total number of people with Kabuki syndrome within a population at a particular time. Prevalence is one indicator of the burden of disease on a society. Burden is a technical term here that just refers to the cost for individuals and communities that are associated with a specific disease. Because prevalence is used to calculate the cost of the disease to society, it's used by policymakers and clinicians when making resource decisions. Having an accurate prevalence ensures we can maximize the resources that will be allocated to benefit people with Kabuki syndrome. More resources means more eyes on our disease and more funding. It makes us more attractive to investigators in academia and industry, and helps us advocate for and urge these professionals to prioritize developing treatments and clinical trials. One of our strategies to update the prevalence of Kabuki syndrome is by obtaining a unique ICD code. So in your medical chart, every symptom and disease has a specific code except for Kabuki syndrome. These codes are unique numbers called ICD, and in the United States, they're managed by the Centers for Disease Control, or the CDC. A hospital or health system can readily pull information about the number of patients it sees that say have the flu, and that supports data collection and calculation of the prevalence of the flu that year. It can also help families navigate insurance approvals and get treatments, and it can help them be connected to clinical trials. So we started an application for an ICD code specific to Kabuki syndrome. As you can see by this timeline, the path is long. It usually takes about 18 months. We started this process in August of 2023, and we are currently tracking with all of these major milestones. It is very possible that we'll have an ICD code for Kabuki syndrome in October of next year. This code will be specifically for the United States, but we are also exploring expanding it, which requires working with the World Health Organization. If and when that happens, we'll be shouting it from the rooftops and asking for your help and sharing this good news and supporting this effort to update Kabuki syndrome prevalence. And I want to talk about other things that you can share today. When you share our mission with a friend, when you share our posts on social media, or specifically when you talk about research, when you're with other Kabuki syndrome families, you truly make a difference. The more we share that healthier futures for our children are possible, because we are driving the work, the more people we can reach and engage them in the work too. We've seen and heard today that the job is ours as caregivers and adults with Kabuki syndrome, and we are motivated like no one else in the world. So I encourage you to reach as far as you can. Can you start in your own home today and complete the survey? Then can you start that checklist? Then can you reach out and share your efforts on socials or at school or at your workplace? The important thing is that you choose one thing and start. And when it comes to donating, thank you to those of you who have already made a donation today. Now, how can I help you reach more people in fundraising efforts? And will your employer reach with you and match your gift? If you want to host a fundraising event, we can provide you with all the support you need to succeed. We are making tremendous progress with your help. All of the initiatives we talked about today are funded by community donations through KSF. Specifically, over $80,000 have supported the projects that help prepare our community for clinical trials. Now, we recognize that it can be hard, of course, to reach. Some days we can't reach very far. I'm a caregiver too, and I understand. But participating in research, donating money, sharing your story, these are all ways that you can make a difference. And I'm happy to share that we can also support you with free mental health therapy training or resources with this generous offer. It's also a research study through Project Wellcast. It's funded by the National Institutes for Health, and I've included the link for this project on the research checklist as well. And you can find that over in the menu. In a few minutes, we'll be talking to people with Kabuki syndrome about their mental health. So we hope to offer resources that can support everyone here today. On a final note, I want to highlight some of our most popular resources on our website, particularly this quick start guide that is available in Spanish and in English, and we can add that to the chat now. Our website is full of information. You can always contact us with questions. Please let us know too if there's something else that you would like to see. I sincerely appreciate and welcome your feedback. And I hope you reach far today to participate, to activate your community, and donate if you are able. We are making treatments possible. I'm now very excited to introduce Dr. Corinne Stobaugh, who has been working on what will be probably the ultimate resource for families, clinicians, and researchers, the Clinical Management Guidelines.